Western University, FEMA. How would you like me to call you?
Just call me JP.
Okay, Sir JP. So let me just check some of your information and please correct me if anything is wrong or incomplete. So what is your name, sir?
My name is John Fritz Adelaide.
And how old are you, sir?
I'm 21 years of age.
Okay, where do you live?
Barangay Cantargo, City.
And when is your birthday?
On February 6, 2000.
What is your marital status?
Single.
Okay, good. So let's proceed with the interview. Is it okay with you, sir?
Yes, nurse.
So what brings you here to the clinic?
I'm having a headache for almost 3 days.
3 days already. So could you show me where you are feeling this headache?
In the Sunroof head,
Does it occur only in that particular area?
sometimes
Oh, on the sides. So if you were to describe this headache, how does it feel like? Is it throbbing, squeezing, constant, unrelenting, or intermittent?
intermittent.
Okay, it's intermittent. So on a scale of 0 to 10, with 0 having no pain and 10 having severe pain, how would you rate your pain?
8.
8. So when did this problem start?
Just this week.
Okay, so how long does an episode last?
About 10 minutes.
So does your headache come and go or is it persistent?
It comes and it goes.
Okay. So how often do you get this headache? For a day or a week?
I experienced this headache for 3 days.
This week, sir?
Yes,
Okay, so since it started, has it been getting better or worse?
worse.
Okay. So what were you doing when this problem first started on the first day?
So in the first day, nabasa kong ulan. Then after na,
Pilaban sir.
nakapinakong
And on the second day, sir?
So sa second day, nagama ko mga activities, assignment sa akong laptop. Then muna to tungod sa radiation. Di ko gagamit ang laptop. Nagsakit na akong ulo.
Asa po, mag-sir, asay mata. On the third day, sir, nawala ng sakit or mas di grabe?
Mas di grabe na nung nagsakit sa
Okay. And what makes the problem worse?
Nakaka-grabe ato kay tungod sa radiation o sa suga sa gadget.
Oh, na-sensitive na noon ka, sir, sa mga lights, gadgets, due to radiation. And what makes the problem better?
Akong gibuhat, take ko rest every 10 minutes. Papawayan na ako kumanta din. Kusan ako kumubalik din. Humana na. Pag musakit na po, kusan ako ipapiso sa ko ang
Okay, so you just turn off the lights and keep yourself away from gadgets. You also took time to rest and you let your father massage your head. And besides headache, sir, do you have any other symptoms like cough, nausea, fever, colds? Do you
They just
experience this
keep sneezing.
every morning?
Yes.
Kung ano ni sir, kanang frequent na ni siya, sir, like example, allergic rhinitis or karon na dyan ni nga tayo na headache.
Karon ba yung bago na?
Okay, so do you have trouble sleeping or wala na?
Wala.
Okay. And do you think kaning sa imong sneezing, sir, related na siya sa headache or dili?
Dili na.
Okay. And what do you think is the cause of this headache?
I think the weather condition.
O kana pong sa radiation, sir, no? How is this headache affecting you?
Nakapikto niya siya sa ako ang kuan. Like, sa gabal niya siya sa kung mga buluhaton. Nag-andaw.
So, does it interfere with your daily activities?
Sometimes.
How about your relationship with others? Does it affect your attitude?
Dili ko kayo.
Dili kayo. Okay, thank you for that, sir. Now, let's proceed to the next part, which is the past medical history. I am going to ask you about your past medical conditions and health. Is it okay with you, sir?
Yes, yes.
Okay. So, if you were given a chance to rate your health on a scale of 5 being excellent, 4 being very good, 3 being good, 2 being fair, and 1 being poor, how would you rate your health?
Or
Okay, 4 being very good. So, as an adult, sir, what medical conditions have you been told you have?
hypertension, high blood pressure.
So, kanisa ka
2 years ago.
Okay, 2 years ago. So, do you have any high blood pressure, sir? No?
Yes,
What about diabetes?
no,
None. What about cancer?
none.
Okay. What medications do you use and what do you use that for? Bakit ito man natambal, sir?
Wala.
Okay, wala. So, wala kayo maintenance sa inyong hypertension.
Wala na.
How about vitamins? What vitamin or supplements do you take and how do you know those?
Kuan. Potency.
Potency, ikapila ka mo inuman na sa kadlaw, sir.
1 tablet.
Okay, 1 tablet a day. Do you think it is effective?
For me, yes.
Is there any side effects or wala lang? So, do you have any allergies like sa food or medications?
None.
Have you ever been hospitalized? What was the reason and what happened?
None.
None.
I'm
Okay.
very experienced.
So, have you ever had a surgery?
None.
None. Have you ever had an accident or injury that needed medical care?
Yes.
What happened?
Accident like playing basketball and it broke my
Your clavicle, sir?
clavicle.
Here, which part? Left or right?
Right.
On the right side. So, have you ever had a blood transfusion?
No.
How about blood donation?
Yes.
When is the first time?
In
Red Cross?
yes. In September.
Just last year, so September 2020. And on your second blood donation? None.
None.
So what illnesses do you have as a child? Did you have chickenpox, measles, dengue?
None.
None? So over the past 2 weeks, have you often been bothered by feeling down, depressed, or hopeless?
None.
So do you regularly have your blood pressure checked?
Yes.
How often do you do that?
Once a week.
Once a week. So what were the results? Is it high or normal?
130.
Well, like
124.
124 over.
Over 80.
So do you have any problems with your eyesight?
None.
Alright, now I'm going to ask you about your family itself. So how old are your parents?
My mother is 49.
49.
My father is 51.
Can you describe their health?
So my father has sinusitis and allergic rhinitis.
How about your mother,
My
sir?
mother has goiter and diabetes.
Okay. How about your brothers and sister? How old is your brother if you have?
My brother is 27 years of age.
So he is older than you. How about your sisters? Do you have any? 19? How
Twins.
many? Oh, okay, twins. Are they also healthy?
Yes.
How about your older brother? Does he have a medical condition?
Asthma.
Okay, asthma. How about your twin sisters? Do they have any?
And
Okay. Do any medical conditions run in your family?
yes.
And let me ask you about specific conditions that are very common. Has anyone in your family been told that they have high blood pressure?
Yes.
How about diabetes?
Yes.
How about cancer?
No.
No. How about heart disease?
No.
Okay. How about asthma, sir?
Yes.
Okay, yes. So now that we are done with your family history, I'm going to ask you about your personal and social background. So how do you feel about yourself today, sir?
I am good.
Oh, so you're feeling good. That's good to know. Do you feel any discomfort aside your headache?
No.
Okay. So may I know what is the highest level of school you have completed?
Senior high school.
Are you still studying?
Yes. I'm third year college.
You are taking up what course?
Bachelor of Science in Criminology.
Okay, so do you have trouble sleeping at night, like insomnia? Okay,
None.
none. So do you eat regularly?
Yes. 3 times a day.
How about your snacks? Do you also
Yes.
have snacks in the
Early in
afternoon?
the morning and late in the afternoon.
Okay, so you don't skip meals.
Yes.
So what type of food do you usually eat?
Fish, vegetables, and
any other languages aside from Cebuano?
Yes.
What is it?
English.
English and
Tagalog.
okay. So which language do you prefer?
English and Tagalog.
Okay. So may I know whom you are living with?
I'm currently living with my family at my grandmother's house due to Typhoon Odette.
Okay. So do you have any problems during any activities?
None so far.
Okay. So what type of home do you have? Do you have like apartment, single home?
Two-story.
Okay, two-story house. So do you work?
No, I'm student.
Okay. Yes, you're still studying. So do you smoke, sir?
No.
How about alcohol?
No.
Okay. Do you exercise?
Yes.
How often?
Daily.
So you're doing exercises every day. What type of exercise?
Jogging.
Jogging,
Biking.
biking, and do you also play any sports like
Yes.
basketball?
Basketball.
So do you have someone who can help you if you are physically ill or emotionally upset?
Yes, my mother.
Okay. So do you use sunscreen or other skincare products?
No.
No. And do you have any weapons in the house?
No.
Do you have a living will, like a written statement about your healthcare wishes?
No.
Or have you designated someone to make healthcare decisions for you if you are unable to do so?
Yes, my parents.
Okay, that's great. Okay, sir, so I'm just gonna restate what you have said earlier. So you have been having headache for 3 days now. The pain is around 8 and this occurs when you are in front of your gadgets for a long period of time and you try to rest to ease the pain, right?
Yes.
So that's it for the interview, sir. And thank you so much for your cooperation. We will just call you if you will have another interview or test. You may leave now, sir.
Thank you, nurse.
Thank you, sir. The patient, Mr. John Pace Adalid, 21 years old. The patient's chief concern was severe headache for 3 days already. Mr. Adalid is a 21 years old who appears young according to his stated age. He is well developed, fit, pleasant looking, alert, in no acute distress, normal, and when looking for notable characteristics, no tattoos, piercings, or scars were noted. Mr. Adalid has plenty of moles in the face, thick eyebrows, and has an overbite teeth. He is well groomed and clothes are appropriate for age, gender, season, and occasion. He is cooperative throughout the interview and makes good eye contact without staring. The client did not exhibit any abnormal movements such as tremors and hand wringing. That concludes my presentation for this patient.